Good morning once again from the Root Cause Medical Clinic, where we normally talk with Dr. Axe, and we're talking with somebody this morning who is part of his team. This is so interesting what they were doing here. We're talking about thermography with Kristen Burton here. Tell us a little bit about what this clinic is doing here with thermography and why this is really kind of different and a unique approach to finding out, to getting what that root cause of maybe someone's issue or their pain is, Kristen.
Well, we're here at Root Cause Clinic to help the doctors who are trying to help the frustrated people who have these vague symptoms. They're not sure, why are they tired? Why are they anxious? Why do they have foggy thinking? Why do they have pain? And so what thermography does is it looks at the body in the infrared spectrum and it finds inflammation, which is oftentimes the first little cause of any kind of disease process.
So talk about where this machine is able to look at. Tell us a little bit more about this camera too, which I understand the one right here in this office is even pretty unique on its own.
Yes, it is. It's one of only a few in the United States that have such high resolution. So we're very proud to have it and very proud to offer it here at Root Cause Clinic. And so what we're doing is we're looking at various regions of the body and looking for temperature differentials that tell us that there's inflammation, blood profusion. Inflammation is the cause of, you know, all these little tiny vague disease processes that may be getting started up. But right now, people are going to their doctors and all their tests are normal. So their doctor is saying, your thyroid's normal, your adrenals are normal, your liver is normal. And yet we look and we see that it's struggling because the body is sending blood there to try to fix it. And so from there, we can help the doctors here at Root Cause Clinic kind of point their treatment in that direction. And we can also help them monitor it as they go through treatment.
That's what I was going to ask, because you can get the initial imaging, right? And then you check back in and see if there's any difference.
Right. And right here at this clinic, I'm seeing so many success stories where we're imaging them, we're seeing their inflammation and their struggles, and then they start on the treatment here. And then we see them maybe a month later, 2 months later, and we can show them how what the treatment they're doing is working. And also, sometimes we might have to go to plan B, and that's good too, so that we can tweak the treatment before, you know, too much time passes.
I want to brag on you a little bit too, and this is something you train, and kind of talk a little bit about kind of your specialty in this, and I love how passionate you are about this.
Yes, so I've been in thermography many years. I've trained under some really great doctors, and now I'm a trainer of thermographers and also a master trainer. So I went over to Europe and taught trainers how to train others, and so it's really an exciting field to be able to launch the science of thermology, which is the study of medical thermography, and help the thermographers across the country and indeed across the world become successful and bring this modality out into the public.
I was going to say, do you see this kind of the future? I mean, do you see this expanding more, seeing more people, you know, seeing the benefits of what this can do? Absolutely, because more and more people want to get to the root cause of what's going on in their bodies. And to see inflammation is a very important piece of data. And so we can use it with other forms of medical data to really add kind of a piece of the puzzle to help doctors discover what's going on in patients' body and implement the proper treatments sooner. Yeah. Well, if someone is watching today and they go, okay, I want to find out more, you're here what days of the week?
We're here every Thursday imaging, so you can call Root Cause Clinic and you can schedule some time with me. We're going to take a detailed health history. The imaging is painless, no radiation, nothing touches your body, no needles, nothing like that. So it's one of the easiest imagings you'll ever get. All right. Well, again, if you can't tell how passionate she is about this, I don't know what will. Thank you so much for allowing us to be here today. It's exciting to see how you're able to help families and help patients. If you want to find out more, of course, they have a great website, but go to our website as well, tbmorningblend.com.